Welcome back. You are listening to the Maryam Mkwanda Show on Salam Media. It is time for our Women's Health Tuesday with our OBGYN, Dr. Tom Mokaya. Today we are discussing preeclampsia and eclampsia. If you're probably wondering what in the world is that, then do stay tuned. A good day, Dr. Tom.
Hi, good day to you and to your listeners.
Thank you for joining us once again, Dr. Tom. Please help us understand what is preeclampsia and eclampsia.
And now, preeclampsia or preeclampsia, if I may go back a little bit, during
Yes.
pregnancy, one can develop particular complications. And there are many complications that may occur during pregnancy. But there are a group of complications called hypertensive diseases of pregnancies. That means those complications are associated with high blood pressure. And high blood pressure, which may develop before one falls pregnant or during pregnancy. So preeclampsia and eclampsia is classified among the hypertensive diseases of pregnancy. That is diseases which are associated with high blood pressure. Now, to give us small description so that one can be able to see where this falls in the bigger picture, broadly, to simplify it, the hypertensive disease of pregnancy can be classified into three broad categories. One is what we call as chronic hypertensive diseases. This is somebody who has high blood pressure, and then they fall pregnant. And during pregnancy, that high blood pressure becomes worse and it develops complications. And then there are people there are moms who don't have high blood pressure. When they fall pregnant, after around 20 weeks, they develop blood pressure, which with time gets worse. Now, if the blood pressure develops after 20 weeks of pregnancy and it was not there before, and it continues to progress and get worse, then we consider that pregnancy-associated blood pressure. And then there are people who book into the clinic after 20 weeks or 30 weeks. Then we don't know where they had it before, or they didn't have it, or they developed after 20 weeks. Those are called unclassified. Now, the ones who develop blood pressure in pregnancy, as the pregnancy progresses, the blood pressure may get worse. And as it progresses and it gets worse, they may develop other complications like kidney problems or heart problems or brain problems. When that happens, then they develop preeclampsia, which means that they have developed blood pressure of pregnancy, and it has gotten worse, and it has developed complications. And so those complications mainly, yes. So you're about to ask, sorry?
Doctor? I wanted to ask
yes,
what
those
are the signs
complications
and symptoms?
Now, the signs and symptoms of preeclampsia. Now, the signs is what we see. The blood pressure is normally very high. We check their urine and they have proteins in urine. Very rarely, some of them may develop swelling of the feet. So those are what we find. But some of them may develop severe headache, and they may also have difficulty in vision. So those are some of the signs of preeclampsia. You're pregnant, your blood pressure is high, you may develop swollen feet, and you may have difficulty in vision. That is what we call preeclampsia.
Yeah. So can one only get preeclampsia during pregnancy?
Now, yes, preeclampsia means it's pre-something. Now, eclampsia is when one is pregnant, they have developed those symptoms, and then in addition to that, they start having convulsions or fits. So it's as if they're having epilepsy. Now, when one develops that complication of pregnancy, where they get fits and they have convulsions as if they're having epilepsy, that is what is called eclampsia. And it can only develop when one is pregnant.
All right. So how is it diagnosed?
Now, if I may also move back a little bit, is that when one is pregnant, it is important that they attend the antenatal clinic, because during the antenatal clinic, some of the things that we routinely or most of the time we check is we check the blood pressure, we check the urine. The reason why we check the urine is to look for either if there's an infection or if there is proteins. Now, if there is proteins in urine when one is pregnant and the blood pressure is high and that proteins is above a particular level, then we make a diagnosis of preeclampsia, high blood pressure and protein in urine. And if that gets worse and they start having convulsions, then we make a diagnosis of eclampsia. And as I say, this can only happen when one is pregnant.
Okay. What treatments are available for both eclampsia and preeclampsia?
Now, preeclampsia and eclampsia, is important for one to realize that they are very dangerous complications of pregnancy. And to give you an overview, before the advent of diseases like HIV, eclampsia and preeclampsia was associated with the highest level of mothers who have severe disease and even demise, what we call as maternal mortality and morbidity. Those complications were among the highest cause of deaths in pregnancy and even deaths of babies, which what we call as prenatal mortality. And therefore, once the diagnosis is made, the treatment has to be quick. It has to be managed by an environment where the mother can be managed and where the baby can be managed. The ultimate treatment of preeclampsia or eclampsia when it gets worse is to deliver the baby. But before we reach there, we have to control the blood pressure and we have to control the complications. And these complications include complications of the kidneys, complications of the lungs, complications of the brain. So all those, and obviously, most importantly, we have to control the blood pressure. And there are many drugs that we use to control the blood pressure. So the mainstay is to control the blood pressure, prevent the fits, and deliver the baby.
Okay. So if it's not treated, can it be fatal?
Very good question. Even when it's treated, if I may answer your question in reverse, even in instances where it is nicely and perfectly treated, the demise rate is almost 3 to 5%, even in very good centers. So in areas where it's not treated at all and it gets worse, not only will it lead to the demise of the mother, it will also lead to the demise of the fetus. So untreated preeclampsia is extremely dangerous. So it can be fatal if it's not treated and if it's not treated well.
Wow, well, definitely something worth paying very careful attention to. I know my sister, I think she might have had preeclampsia because back then we didn't know what it was. We just saw that she had um, a high blood pressure, swollen feet, etc., etc. So, yeah, if we learn about these things, we will know exactly how to deal with them. But thank you so much for your time, Dr. Tom. It has been a pleasure.
Thank you. Thank you for having me in your show. Thank you.
Thank you. Bye bye.
Bye.
That was Dr. Tom Mokaya, our resident OBGYN, chatting to us about eclampsia and pre-eclampsia. If you have no idea what it is, don't forget to view this a little later on. If you've just joined us, unfortunately, we have concluded chatting to Dr. Tom, but the video is up on Facebook for your viewing pleasure later on. It is 12:50. To stay with us, we will be right back after the break for the competition.